Greetings, Unhidden Voices family, and welcome to episode 27. I promise you, you are going to enjoy this episode, and it is vitally important for you to listen to it, to learn from it, and to amplify it because I interviewed Nurse Faye. Nurse Faye is a black nurse with 38 years of experience, and she talks about the COVID vaccine. She talks about the fear of it in the black community. She talks about what we need to do to prepare to get vaccinated, what we need to do while we're getting vaccinated, and what we need to do after we get vaccinated. And she also talks about the importance of every black person getting vaccinated. So please, please, please listen to this episode. Please subscribe to this podcast. Please share it with everybody you know and listen, learn, and amplify with us. All right, so this is so exciting. I'm so glad to be talking to you. And for our audience, I actually met Nurse Faye when I was waiting after I had gotten my first dose of the COVID vaccine. And I asked her to come on to our podcast to talk about, working specifically with COVID and the Black community. But I wanted to learn more about you because we just started talking just, very briefly for that 15, 20 minutes. So can you tell us, a little bit more about yourself? Like, how long have you been nursing and what made you interested in the profession?
I have been nursing, and I wish you could see me other than that wedding photo up there.
It's a beautiful photo.
But I've been nursing for 38 years now.
Wow. Yeah.
And I started in my 20s, and I've been in OB. I think I did OB nursing for maybe like 25 years or so. Other places in the hospital, psych, hospice, med-surg and stuff like that, but basically OBGYN nursing.
Wow. And so then now you because were you always nursing as you were a travel nurse now? Have you always?
No, I'm a travel nurse now. I did in-hospital nursing for years, and I started to kind of later in my career after my children were grown and gone, I started travel nursing, and I did that for a little bit and I liked it. But I did a travel assignment out here in California at UCSF, and then I became staff nurse. So I was staff nurse out here for 7 years, and then I retired. Oh. And so I've been retired since 2018. And I didn't realize that, to come back to work, I would have to have been working for at least sometime during that year. So I did get a position at Watsonville, California last year in February.
Okay.
And that was just for a couple of months. So before this position, I hadn't worked at all.
Got it. So what made you want to become a nurse in the first place?
As a young person, I've always wanted to be in the medical profession. My mom worked at a hospital. And back then, of course, that was a long time ago where they had candy stripers. Mm-hmm. And I volunteered at the hospital. And then they had the youth co-workers. Candy stripers, you don't get paid. You're just volunteering and you're just doing whatever. And basically the same thing as a youth co-worker. As a youth co-worker, I worked at the hospital with my mom, and I just decided, okay, I just like taking care of people, helping people. And I decided, okay, I think this is what I'm going to do when I grow up. And at first I started out wanting to be a doctor, but then I had 2 children when I went back to nursing school, and I went back to nursing school full time, and just became an LPN. And then working in the hospital, I decided, okay, I don't think being a doctor is going to be for me.
Yeah.
I would, in order to be a patient advocate and being there with the patients, I needed to be where I could work directly with the patient. So that's when I decided, okay, I became an LPN, and then I went back and got my RN.
Okay. And so, I know I've heard RN and LPN, but just RN is registered nurse. What does LPN stand for?
LPN is licensed practical nurse.
Got it.
And here in California, it's LVN.
LVN.
Licensed vocational nurse, yes.
Yes. Okay. So you talked a bit about this, this when you were talking about wanting to be an advocate for your patients, but
Hmm.
I'm interested in knowing specifically about Black patients. And have you witnessed Black patients being treated differently?
Oh
Um,
yeah.
can you talk about how that happens and what that's like?
Oh yes, definitely. I have witnessed that uh, throughout my entire career, even as an LPN, and it's really heartbreaking. And I have tried to be an advocate for them as much as I could, even as an LPN. I've seen nurses mistreat patients, and I've had to step in. Patients don't realize they have a voice. I think they do more now than they did then.
Yeah. Yeah. Yeah.
Because it was just that stigma that you listen to the doctor, you do what the doctor says.
Hmm. Hmm.
Not necessarily. And I have had to tell them, no, you have to have some control of your care.
Yeah.
So don't just take what they say, read about what's going on.
Mhm.
If they give you a medicine, look it up,
Yeah.
know the side effects of the medicine,
Yeah.
know what, if they're giving you more than one medicine, know what, reacts to this medicine or don't react to that medicine. Know about your care.
Yeah.
So I have had to do that
Mhm.
throughout my career, but I have seen patients mistreated that have didn't have insurance, treated differently than
Mhm.
patients with insurance.
Mhm. Yeah. I it's funny that you said you were OBGYN nurse for so long. And because I was having this conversation last night with a few friends of mine. We do this like weekly, we watch movies together. These are friends I grew up with. And we were talking about how Black women have such difficult time with like infant mortality and all that. And I was saying that out of the I have 4 children, all of them are adults.
Mhm.
My youngest is 20. But my first child and my last child, both of them I almost died giving birth to them. And I was a healthy person, and this shouldn't have happened. The first time it
Right.
was, but it was also the last time that the doctor was a resident, and I only knew about residency because I used to watch ER all the time. So I was like, wait a
Mhm.
minute, you're a resident. Because she was like, really, this is my fourth pregnancy. So I knew like what I was going through because I had gone through it 4 other times. And she was basically telling me I wasn't my water didn't break. She was like, your water didn't break. You peed on yourself. I said, I did not pee on myself. And they tested it and it was amniotic fluid. And
Mhm.
then she was like, well, we're going to give you this medicine, and didn't tell me anything about it. And then was just really rude and nasty. And the nurse actually, because I was like, I don't want this person, treating me. And it was funny because I was in there like really late at night. So it was not that many folks on the shift. So they were
Mhm.
basically like, well, if you don't, she might be the only person able to help you. And I was just like, well, I'll just sit here until somebody else comes. And so, but it's weird that I think a lot of times we just don't know, we just don't know. And,
Right.
we just don't know. We know we're being mistreated, but we don't know, what we're
What
supposed to
to,
do.
to to what extent you're being mistreated?
Exactly right. Exactly right. And then,
Mhm.
the other piece of it is that we're so vulnerable. When you go to the doctor, it's just like the most vulnerable time. So you really want to be able to trust that person to
Mhm.
give you the right information and stuff like that. Like when I met you, I was getting my vaccine, and the nurse who gave me my shot said literally, he was like, uh, if you what did he say? He said, you might experience some pain with the injection. And then he was like, if you go home and you have a severe reaction, you know what to do. And then he starts laughing.
Mhm.
And that was it. And I was like, I don't know. How do I know what to do? Like
Right.
this is a COVID vaccine. Like I have
Mhm.
no idea. This is like brand new. And so I was so kind of, I was already just kind of out of it because I didn't, I was nervous about doing the vaccine and stuff like that. So I didn't say anything. And then when I actually left, I had, like body aches and muscle aches and a headache. And my husband was like, did you, what are you supposed to do? And I was like, I don't know. I have no idea. I do not know what I'm supposed to do. And that sucks so much. So I guess the question I have for you is like specifically about that, about the vaccine and about like it's a two-part question. One is about the fear that Black people have. Why do you think Black people are so nervous about getting the vaccine? And then secondly, it's like, what are we supposed to do? Like, what should we be doing?
You mean after the vaccine?
Yeah,
or
after you
before?
well, I think it's two, like before and after, like in order to prepare for the vaccine, and then after you get it, the first and second.
Yeah, to prepare for the vaccine, and I tell people what they should have been doing all along, but you can boost your immune system. You can start taking vitamins, and it really, if I could have publicized it to have people take vitamin D at the start of this pandemic, I don't think as many Black people would have gotten the COVID. That's just my thoughts now. There's no studies or anything. Okay. But Black people don't have the vitamin D in their system because we're not out in the sun. We're dark, and we burn just like white people. So we're not going to get out there and try to get darker. So we don't have vitamin D. So I tell them, okay, start taking you some vitamin D, start taking you the elderberry, calcium, take your multivitamin, and just boost your immune system. Now, as far as the fear from getting the vaccine, the fear is real.
Yeah.
And I understand the fear, but people have got to overcome the fear of being mistreated, because when you look back, we have been treated worse than dogs.
Yes,
worse than dogs. And I understand that. And I'm fearful, even as a healthcare professional, I'm fearful because I just got my second vaccine, and I went to two young ladies to give me my vaccine. One of them was brand new, and she told me, she says, "Oh my God, you want me to give you your vaccine?" And I said, "Well, yes, I do. I want you to give me my vaccine." And then the other one, I went to a Black lady because I'm fearful too. I'm sorry, but I'm fearful. Yeah. And I'm afraid of being stuck. But I'm like, okay, if I had gone to a white person to give me my vaccine, and I don't like to watch, but I do, and I would have to make sure she gave me all of my vaccine.
Oh, that's right. Because that's the thing they said in Oakland, that people weren't getting the whole dose. They left out like some milliliters of the.
Make sure they push it all in. I watch. I want push all of it in. Push all of my dose in there. And also, it's so sad, and it's really hurtful to be so fearful. But I look at the vial. I want to make sure that you're drawing up the right stuff.
Okay. Oh my God.
The thing at Moscone, though, they have pharmacy techs and nurses drawing up the vaccine. Okay. So they draw them up and they put the number on it for us. And all we have to do, it's drawn up. However many cc's or milliliters it's supposed to be, it's already in the syringe. The number is on there. We just take the number off, confirm the number with what's in the computer, put it on the patient's card, and we give them their injections. Yeah. We don't have to do any drawing it up, but on the TV and on the news, you see a lot of people drawing it up. Yeah. And then they're giving the doses.
And so you just have to because especially like I would wonder with the drive-through ones,
right?
You're just still in your car or whatever, how you definitely need to be paying attention. But like,
it's probably already pre-drawn up for the drive-throughs, I would think. Okay. I'm not sure. I have not done that. I haven't done that, and I don't know anybody that has gone through the drive-through.
Yeah, my brother went through the drive-through at the Coliseum, and
Uh-huh.
and then today I watched them saying that the folks in the Coliseum, like 4,000 people didn't get their full dose.
Mm.
And they said that some whistleblowers contacted the news and told them, and then they did an investigation, and then they admitted that they weren't giving people the full dose, and they didn't have the proper syringe for doing that or something. But they said, well, if you get half of it, you're still okay. But I'm like,
No,
how do they know that?
no, they should give us the full dose. Give
Okay.
the people what they're due.
Mm-hmm.
The full freaking dose. I'm sorry. Yes. What is that? If you get half of it, you're still okay. No, give me what everybody else has been getting. I want the full dose.
Yes, yes, yes.
Yes.
But that's right, and that's what's happening, of course, in Oakland at the Coliseum, and
Mhm.
that's black and brown people,
Right. Right.
majority, and of course they don't care about us, so they're gonna just be like, get what you get,
Uh,
that sucks so hard. I mean,
mhm.
and the thing is, like, I remember when I was telling my family I was going to go get the vaccine, I was so excited. And
Mhm.
then they were sending me like pictures of people with their eyes burning and stuff. Like people were really afraid of the vaccine itself. So
Mhm.
that's the other thing. Like, and can you talk a little bit about the vaccine itself and what we should be knowing about, like what the symptoms are and what to expect, from
The
it?
the from the Pfizer, we're giving the Pfizer at the Moscone Center.
Okay.
And what I tell people, their first dose, you will experience some pain at the site, maybe some redness. You may get a fever, have a little dizziness or whatever. Shouldn't be anything serious, no serious side effects. If any side effects will be something like the common cold or the flu.
Yeah.
So, you can take Tylenol, you can take Advil, you can take Motrin for the pain. Do not take anything for the pain, for your a fever, anticipating that something's going to happen,
Got it.
because that diminishes the dose, the effect of the medicine. So don't take anything before, but
Got it.
after that, you can take that. And we pass out those forms. When I pass out the form, I tell them to read them. This is some good information. This gives you the signs and symptoms. This tells you what to do. Body aches and pains is like the flu.
Mm-hmm.
And if you may have those 2 days after you get the second dose. If you have those 2 days, then you stay away from people. If you have them for more than 2 days, then you get your COVID test.
Okay.
Serious side effects, I tell all of my patients, serious side effects is because just having like body aches and pains, that's okay. That's normal. Those are normal, not severe side effects. Severe to me is when your chest is tightening, you can't breathe. You go to the emergency room.
Mm-hmm. Mm-hmm.
You go to the emergency room for that. Any tingling, little mild tingling you may have, these are not listed, but we have had patients that have had tingling in their fingers, tingling in their tongues, and I had the physician to give one lady a Zyrtec. It went away immediately. Before he gave her the Zyrtec, he just says, I'm going to give it to you anyway. So,
Got it.
yeah. But, the body aches and pains, those are, normal side effects. And that just letting you know it's working.
Yeah, that's what they said. Like with me, I did have that. I had it for 2 days. I would have, but that was with the first dose. But then I also had brain fog. I felt like I had a head cold,
Okay. Yeah.
Yeah, but and I wasn't, and that's not like a friend of mine sent me. I guess the CDC is doing this, like where you could do a medical check-in with them, and they have a list of symptoms. So I downloaded it, and I started doing that on my phone because I was having body aches and stuff, and a headache, and the brain fog, but the brain fog wasn't listed as a thing.
Right.
you know. So is that not? It's just probably maybe it was just me. Maybe
and
that's
and
not
and,
common.
and that just I tell people, it's just everybody is different.
Mhm.
Everybody is different. Everybody's body is different. you're not going to have the same signs and symptoms as somebody else. And somebody else will have signs and symptoms that's not on this list. But if you feel like they are severe enough that you're feeling bad enough, you go to the doctor. You know, don't rely on what somebody else says, because I have had patients 90 years old, had no symptoms, none. And then, you know, a lot of patients, because they have gotten themselves so worked up about this vaccine and trying to get it, when they do get, and they're reading about it, and when you read about it and you look at all the signs and symptoms and you have internalized what everybody else has had, you're going to think, oh my God, this is one of the signs and symptoms of the vaccine. I just got my second dose, and some of the patients were telling me that someone had told them when you get it to move your arm that you won't have any pain. Some say put ice on it, you won't have any pain. I did the moving. I took my vaccine, and I went immediately back to work. I kept moving. I never stopped. And I never stopped moving my arm. I haven't had any pain. I haven't had to take anything. And, you know, as a healthcare worker, you know, they say nurses and doctors are the worst patients. So I'm thinking, okay, I hadn't had any signs and symptoms. Did they give me my dose? Did they give me? So the only assurance that I had is that I had this young lady, black lady, give it to me. So I was like, okay, I got my medicine. She gave me my dose, so I'm okay.
Yes. So how do we convince our Black people to feel more comfortable with it, to getting vaccinated? Because that is the biggest fear, I think, for them, for a lot of Black people, is just doing that.
It's just doing it, and it's the not knowing. It's the fear of not knowing.
Yeah,
it's the fear of not knowing the vaccine and what it will do for you, the side effects. You know, and we're, like I said, we're so fearful with good reason. But we just have to give them correct information, as much information as we can. And you know, a lot of people, if you give them too much information, they're going to be fearful. And if they don't have enough information, they're going to be fearful. So I just try to give them enough. You know, just enough information. You know, okay, you need to do this, and you need to go ahead and do it.
Yeah. So the one other thing I think you said that is really important is, like, don't leave without getting the actual pamphlet or information they have on the vaccine. And what kind of questions should you ask, like, when you go there to your nurse or whoever is administering your vaccine? Like, what should you be prepared to ask them?
Well, if your nurse, because the nurses that's giving the vaccine, they have minimal time to sit there and explain to you. So have your questions written down, your questions and your concerns. If you have questions and concerns, there should be people that's watching you for 15, 30 minutes that you can ask. You can ask them questions. And that's when most of the time patients will wave their hand, or they'll beckon for me, and they'll say, can I ask you a question?
Perfect.
And I can take as long as they want to give them as much information as I can give them.
Perfect. Okay, thank you. God, this is so important. I hope everybody, this is so important.
I want the Black people, and I want them to go on and get it. You know, before, you know, I don't know, you know, I have had patients come through there, and they talk about, you know, they don't understand why they're worrying about giving it to the homeless. And, you know, I had to dispel that, you know, because they need it just like we need it. They want to stay alive too. And then if they don't get it, then they're walking around maybe infected, and then they're going to infect somebody else, you know, because they're out there, you know, spitting and talking, no mask on, a lot of them. So yeah, they need a vaccine just like you. They want to live just like you.
Yes, right. That's 100% right. One of the things that I don't understand, you know, and I know they're prioritizing people, but I feel like because we are at a higher risk of dying, we should be priority. You know,
Right.
like I don't get that. Like my husband is not, because he's not a teacher. He's not a, so they're like, yeah, you're, 49-year-old black man. That's the high risk category. But
Right.
because his profession isn't X, they're like, oh, you have to wait. So I don't understand that, because I feel like they should be doing more to ensure that folks who are at higher risk of, severe complications get vaccinated, but I don't know how they figured that out.
I don't either, but we need to figure out a way that we can get, the people out, make them comfortable with getting it.
That's right.
So they can go on and get it and make sure they're getting their total dose, not half of a dose.
That's right. That's so right. Okay. Thank you, Nurse Faye. Thank you.
All right. Classroom. I'm not going to do it online. I'm gonna send you a resource. I'm gonna tag something that you can follow if I don't have the bandwidth, but that's just my opinion.
No. I get that. I agree. I totally support that, and I love that. Like, yeah, just read this. Bye.